Each minute of ischemic stroke untreated, close to 2 million neurons die. So, time is brain. Human nervous tissue is rapidly lost as stroke progresses. That's why anyone should understand warning symptoms and signs of stroke. 5 stroke warning signs established by the American National Institute of Neurological Disorders and Stroke. Numbness or weakness in the face, arms, or legs, especially on one side of the body. Confusion, difficulty speaking or understanding speech. Vision disturbances in one or both eyes. Dizziness, trouble walking, loss of balance or coordination. Severe headache with no known cause. In addition, nausea and vomiting are also possible symptoms. Causes. In most cases, strokes are caused by a blood clot that is blocking a blood vessel in the brain. A stroke that is caused by a blocked blood vessel is referred to as an ischemic stroke. Typical signs of a stroke that then go away on their own after a few hours may be signs of a transient ischemic attack, TIA. This happens when a blood clot forms but then breaks up again before the brain is damaged more severely. People who have had a transient ischemic attack, TIA, are more likely to have a stroke. Bleeding in the brain is the second, less common cause. This occurs if, for instance, a blood vessel ruptures and blood leaks into the brain tissue. About 15% of all strokes are classified as hemorrhagic, with the etiology being the most commonly uncontrolled hypertension. In both cases, one part of the brain is no longer supplied with enough oxygen. The sooner the treatment is started and the oxygen supply is restored, the better the chances are of minimizing damage to the brain. Risk factors. It is very uncommon for blood clots to develop in the blood vessels of healthy people. Certain conditions and genetic factors can increase the risk of a stroke. These include high blood pressure and persistent atrial fibrillation. Other risk factors include diabetes mellitus, hypercholesterolemia, physical inactivity, obesity, genetics, and smoking. Alcohol intake has a J-shaped relationship with ischemic stroke. Mild to moderate drinking carries a slightly lower risk of ischemic stroke, yet heavier drinking increases the risk drastically. Alcohol intake increases the risk of hemorrhagic stroke in a near-linear relationship. Most people survive strokes, but they can lead to paralysis in certain parts of the body or problems with various abilities, such as speaking. Symptoms such as paralysis often get better over time, but they can also be permanent. Psychological problems like depression are also common. Stroke is the second most common cause of death worldwide and a significant cause of chronic disability. Within 12 months of a stroke, approximately 37% will die and 10% will experience a stroke again. Other cardiovascular diseases, such as heart attacks, are also more likely to occur in people who have had a stroke. Prevention. People with high blood pressure can reduce their risk of a stroke by taking blood pressure-lowering medication. Anticoagulants are an option for people who are at greater risk of blood clots forming, for example, if they have atrial fibrillation. Diagnosis. Stroke is diagnosed through several techniques. A neurological examination. CT scans, most often without contrast enhancements, MRI scans. Doppler ultrasound, and arteriography. CT scan has low sensitivity in case of ischemic stroke, but MRI is more useful. In case of hemorrhagic stroke, CT scan and MRI both have high sensitivity and specificity. Treatment. In case of ischemic stroke. Thrombolysis. Within 3 hours after stroke, intravenous tissue plasminogen activator, PA. It increases chance of living without disability after stroke. And aspirin within 48 hours. People with intracerebral hemorrhage require supportive care, including blood pressure control if required. Anticoagulants and antithrombotics can make bleeding worse,